Welcome, and thanks for coming out on such a cold Monday morning. It's a small but interested group, it looks like. So I'm Susan McNulty, and I'm a licensed acupuncturist with a private practice in Ludlow, just over Terrible Mountain. And I've been practicing acupuncture for 30 years, since being educated at the New England School of Acupuncture, which is in Massachusetts, outside of Boston, which was the first acupuncture school to be established in the United States. And I was one of the first graduates in the United States to become a licensed acupuncturist. And so I've always been interested in self-healing. Since I was a young girl, I became aware of the fact that if we set up the right conditions for our body, we could do a lot to create our own healing. Hi, come on, join us.
How are you?
Welcome. So acupuncture is an ancient art and science. It's about 5,000 years old, with its origins in the East, in China. At the New England School of Acupuncture, I was trained in the three branches of traditional Chinese medicine, which are acupuncture, moxibustion, which is the application of heat to acupuncture points, and also Chinese herbology. Those are the three branches of traditional Chinese medicine. So the premise behind why acupuncture works is that it's an energy medicine. The energy of the body is able to be manipulated through the acupuncture points, and the energy of the body is referred to as qi, which is the same energy that runs through everything in the universe. It exists in the body, in every cell of the body, in every organ of the body. It also exists, it's the movement of the universe. It's what creates a flux and a flow that gets the yin and the yang balances of energies to be in opposition to each other, which is always creating a tension and a movement. When it comes to health in the body and the qi of the body, the way that acupuncture can be helpful is that we can manipulate the energy with the acupuncture needles, or by tapping on the acupuncture points, or stimulating the acupuncture points in different ways. That will do, you can get different effects by trying to manipulate the energy. You can help to move energy that becomes stagnant. When there's stagnant energy in the body, it always manifests as pain. And you can also increase the flow of energy to different areas or organs of the body that have lost its vital qi, or its vital ability to function at its greatest homeostatic point, which is the place of keeping a balance. All the organs are in and out of being working in a hypo or a hyper way. That's where the flux of the yin and the yang of the body comes in. And so the acupuncturist's job is to recognize what organs or organic systems might be out of balance, either overworking or underworking. So you can either manipulate the qi by moving stagnant qi, but you can also build energy that's become deficient, and that has, where certain organs may have lost some of their organic ability and just not working up to par. And then sometimes other organs can be overactive, and that in that way we learn how to sedate the organic energy and function of certain parts of the body. So when people come to me, I always look at everybody as a brand new landscape. There's no pat answers to why someone's gotten themselves in a state of imbalance. So I begin my diagnosis with people in my first conversation with them. And so really the diagnosis begins when I'm on the phone with them and they're calling to book an appointment. I'm listening. Everything about them tells me is a little clue. I consider myself a health detective when it comes to figuring how people have gotten themselves into a state of disease or imbalance. So when they call, I begin by listening to the sound of their voice, which includes the volume of their voice, the tenor of their voice, whether they have a tremble in their voice, whether they speak with confidence, whether they tend to sound to be shy, whether it's a chore getting answers from them, or whether people want to tell you their whole story in one sentence without taking a breath. All these begin to formulate patterns of disharmony or harmony in the particular person. So it's my job to stay open and receptive and observant of how someone presents themselves. And then when someone walks through the door, I'm immediately looking at how they hold themselves, their gait, how they walk, how the light shines from their eyes or does not shine from their eyes, whether they're able to make eye contact, their skin, and not just whether they're wrinkled or blemished or rashy, but also, you know, different qualities of the colors of their skin or the pallor of their skin, looking at their lips, looking to wonder whether they may be a little dehydrated. Everything tells me something about them. I'm observing their fingernails, and the way they hold their head, the way they hold their whole presentation in the world. Whether they tend to be very shy and closed down, I'm going to begin to realize that this person has more of a yin personality about them. Yin and yang is a big theme and guiding principle in balance in general, but then in the body. So the yin aspects of the body are things that yin tends to be the more feminine aspects, the cooler aspects, the softer aspects, the deficient aspects, where yang tends to have more of a male energy, a forceful energy. So someone with a very forceful voice, I'm going to know has a strong preponderance of yang when it comes to at least their lung power, because the voice is generated by the chi of the chest, and all of that tells me a little bit of something. Then once, so I'm making observations just without even getting into any kind of a discussion. But once I get somebody settled down, then it's my job to solicit from them what their major complaints are, what they've come to me to see. And I like to ask open-ended questions, because I find that letting people reveal themselves through their own stories is very revealing in terms of what they think about themselves, where they think the origin of their issues stems, and also I just get a greater sense of who they are as a person, how they express themselves. And some people give me one-word answers, and other people tell you everything that's ever happened to them since the day they entered the earth. And all of that, again, tells me whether they tend to be an excessive person or a very recessive person. And then that, again, is guiding me to whether I'm going to have to provoke a certain kind of energy or sedate a certain kind of energy to, again, bring them into balance, where someone wants to be able to be not totally quiet, but not totally overly available with their information. So one of the most important things that someone can do for their own health and well-being is to be very observant of themselves. So I try to, share with them what I observe about them. And I begin by asking about all of the systems of the body, or I ask about what their main complaints are. So I'm interested in things like how somebody sleeps, how many hours they like to sleep, or they, how many hours do they function best in the world after having slept that many hours, and what the quality of that sleep might be, what their patterns are, whether they have nightmares or dreams in general. I want to know about their digestive system. And it's interesting, people are just so out of touch with their bodies sometimes that I can ask somebody, so do you have any issues with your digestion? And they'll say no. And then I start to break it down and I say, well, do you have any Any kind of acid reflux or GERD? Oh yeah, I have that. I take Prilosec for that. Do you have any kind of stomach pain? You maybe yes, maybe no. Gas, bloating, diarrhea, constipation. People don't even know what it means when you ask them sometimes if they have any digestive issues. Um, along with that, one of the key things that is important to investigate with people is their diet and their lifestyle in that way. What do they eat? What foods are they drawn to? What foods do they have allergies to? What foods do they have cravings for? And then how do they prepare those foods? Do they tend to like raw foods, cooked foods, hot fluids, cold fluids? Do they have to have ice in every drink? Do they have aversion to cold drinks or hot drinks? All this is again beginning to tell me about the yin and the yang of their particular constitution, or what the yin or the yang has become. Maybe it's become imbalanced in some way. So I'm very interested in people's subjective opinions about their body temperature, and I'm not asking whether they're 98.6 or 98.7. I'm asking, are they the first one in the room to take off their sweater? Are they always kicking off their shoes and their socks? Are they always needing their hat and their gloves on? Whether somebody is cold internally or hot internally has a big effect on what's happening organically in the body and with the hormonal balances and that kind of thing. So I ask about their circulation and whether they have any issues in that way, whether their, fingertips and the tips of their nose or ears or their lower back, tends to be cold or too hot, if they're always throwing off heat in certain areas of their body, it's very useful. And again, it's always surprising to me how people have never noticed those kinds of things about themselves, but it's very commonsensical to want to know those things. And so by my asking them about those things, it does bring an awareness and then a different way of looking at themselves and maybe realizing that their lifestyle habits are part of their problem. So the other things that I want to know about are their urinary habits. What does their urine look like? How often do they have to go? How many times in the night are they getting up? What color is it? Does it have a smell? Does it change at different times of the day? Does it change depending on what they've eaten? These kinds of things, if we begin to observe ourselves, can really tell us a lot about what's going on, whether we're dehydrated, whether we do have bladder or kidney issues beginning. So I, again, want to know those things. Maybe people are drinking a lot. I ask about their thirst and what their drinking habits are in terms of just staying hydrated. Sometimes they drink a lot, but they don't pee in the right proportion to that. So then I'm going to look to see whether they have edema issues in the body, whether they're accumulating fluids in inappropriate ways, and that'll tell me that maybe their kidney yang energy is diminished, and we need to work on building that back up, which an acupuncturist can do. One of the stories that I like to tell is about when I went to acupuncture school. I understood that acupuncture can be very useful for pain and for addiction, withdrawal from addictive substances. But it wasn't until I was in school for a few months that I once again came down with a chronic bladder infection, which I used to be prone to. And of course, what happens when one gets a chronic bladder infection is you start by drinking your cranberry juice and hope you can stave it off. And one of my teachers saw me sitting there drinking my cranberry juice and asked me what was up. And I told her I've got another chronic bladder infection. She said, well, you should come see me and let me give you some treatments, and we can probably turn that around. And I thought, really? How does acupuncture do that? And sure enough, what happens when you get a chronic condition happening, whether it's in the bladder, the lungs, the immune system, the spleen, or whatever, is that it's lost some of its energy to do the job that it's meant to do. So it's usually an underactive condition when something becomes a chronic internal condition. And so my acupuncture teacher, who became my acupuncturist, knew that my bladder needed some restoration of energy that that it had lost. The course that I was on was that I'd get an infection, and I'd go to my doctor and I'd get antibiotics, and I'd take the antibiotics that would do the job to rid my bladder of the bacterial levels and do the job that the bladder should have been able to do on its own, but because its energy had become diminished, couldn't quite do it anymore. And so every time I took another course of antibiotics, it lost that ability more and more. And the function of our organs begins to atrophy if we don't find ways to regenerate them. And so my teacher, after 2 treatments, my bladder infection cleared up. I did not take the antibiotics, and I have never, ever had another bladder infection again since then. Now, I was in my 20s at the time, so I really staved off maybe a lifetime of issues that would have gone on and created more problems and bigger problems had I not found such a natural way to get my body to bring itself back to balance. And that's really what holistic medicine, acupuncture, can help to do, to provoke the body to do its own healing. The body is an amazing, organic, organized system that does know how to self-correct. We have to become clear about the conditions that we need to create to give it its best chance of correcting itself. And that's one of the things that acupuncture can do. So some of the other systems and things that are going on in the body that I'm interested in are the bowels and all of those bathroom habits that people are a little bit reluctant to talk about. But again, once we start the discussion, they're usually fascinated by how many things I want to know. And when I first went to the acupuncturist, I was really taken aback and impressed by the amount of information that they took in about systems that just made a lot of sense to me. What my immune system was like, how quickly or easily I was able to stave off, say, a virus or an attack of external pernicious influence, we call it in Chinese medicine, which is, germs, bacteria, viruses coming at us from the outside in. What our immune systems are able to do to fight those off is very telling. Asking about the respiratory system, the menstrual system, the nervous system. Lots of questions to women about the menses and whether they have PMS, what their age was when they started, not just whether they have PMS or issues, but what color their blood is, what's the amount of blood that they have, do they have clots, do they have pain, does it begin to affect their moods. This will begin to tell me things about the endocrine system that can be really helpful in terms of balancing all that. And questions about sexual libido and interest tell me a lot about what might be going on hormonally for people too. And these things again can all be given back lost energy, or can also be sedated if things are a little bit hyperactive, which can also happen. So someone can come to me with asthma, for instance, and it's up to me to determine whether their lungs are overworking and creating an asthma that's one of the kind of asthma where it's frothy and there's a certain kind of breathing that has a sound to it, and it's considered an excess kind of an asthma. The lungs are overworking themselves. And then there's another kind of an asthma where people have a very difficult time even gasping a breath. It affects their ability to speak in a clear or a loud voice. That's more of a deficient kind of asthma. And so what I would do in that case is I would find the pathway of energy in the body that is referred to as the lung meridian. Meridians are pathways of energy along which the acupuncture points lie. You can see I have my little acupuncture map here, and all the major organs have an acupuncture meridian that we can access through the limbs or the trunk of the body, but that have internal pathways that go to the internal organs and have certain effects there. So I would find my points along the lung meridian that either sedate the lungs or tonify the lungs, either strengthen the lungs or calm them down, depending on maybe what kind of asthma they have. And then I would determine whether there was a mucus situation involved. And then there are specific points on other meridians where you can help to resolve mucus in the body. So there are thousands of points on the acupuncture meridians and on the body, but really any place that shows pain is a potential acupuncture point. But when you're working organically within the body and the organ systems, then you're working on the meridians and the flow, and you can affect the flow of qi to those organs that then help it to find its homeostasis, help to calm it down. In the case with the bladder deficiency, my acupuncturist found the points on the bladder meridian that she could manipulate to help tonify, strengthen the qi of the bladder. The other things that I want to know about somebody is what their lifestyle's like. How do they spend their time? How do they spend their free time? How do they use their body? What kind of body mechanics are involved on a regular basis? Are they sitting at a computer all day? People come into me with wrist and neck and shoulder problems all the time. I don't have to really find out, although I do, what might be happening with their digestive system. I know that it's a ergonomic situation where they're holding and hunching and scrunching their bodies in particular ways. So bringing in an awareness to them about those conditions by asking about their lifestyle can be all that they need to do to raise their chair, raise their computer, make sure they get up and move around, get their hand off the mouse that they have it frozen to all day long, creating stagnations of energy because things become repetitive motion and wear things down, or that we just begin to freeze into place in some ways by holding our bodies in certain ways. Some people are on their feet all day. They can't really do anything about that because maybe they're a factory worker or a waitress or something. So they may have knee and ankle and foot pain. But part of the prescription for them might be make sure you got the right arch in your shoe, and make sure you're changing your socks so that you're not walking around with damp socks, and very practical things that people may or may not have an awareness of, or may not think is important enough to make any changes. But sometimes just getting a little guidance about those things can make a big difference in actually somebody's level of comfort. And just as an example, someone may begin by having foot discomfort because they're walking around in wet socks all day. Wet, cold socks in Vermont is very common. But I'm constantly telling people to go get a third set of shoes and change them out constantly, because one of the things that can happen is that we can create imbalances in our bodies just by the environment. There are conditions called wind, we can have windy conditions in the body that can happen by wind entering through the ears and through the back of the head in particular. And so sometimes my prescription to people is make sure you wear a scarf, a hat, and cover up. People who have windy conditions tend to have symptoms that resemble wind. They're very twitchy. They get twitches and things that move around a lot in the body, and you sort of have a twitchy quality to them, or a windy quality to them. Other people have damp conditions in the body, and that's because they're walking around in those cold, wet socks all day, and dampness ends up settling into the feet or to the body in general and finds its way to the joints. And arthritis is one of those conditions that we think of as cold, damp, stuck in the joints. And one of the ways that an acupuncturist can help to heal that is to go into the joints and dry up the dampness. And oftentimes we do that by putting the acupuncture needles in place and then heating them up, and the heat will enter deeply and begin to dry up the dampness. But back to the damp socks, so you can begin by having just maybe achy feet and maybe arthritis setting into the feet. But also what happens is that because the kidney meridian's origin is at the very bottom of the foot, here's kidney 1 right here. If people have, for years and years, walk around with, on cold, damp floors and wearing cold, wet, damp socks, that cold damp begins to enter that kidney meridian and can really begin to draw out the heat and the yang of the kidneys, and they can end up with a diminishment of vital energy in general, or a diminishment of their sexual libido, because that energy resides in the kidneys of the body in terms of the way Chinese medicine looks at it. So I'm always looking to see, is it a meridian problem that's created an organic problem, or is it an organic problem due to maybe lifestyle, the way somebody's diet might be affecting their lifestyle. And so I'm also very interested in people's emotional health and well-being. Holistic medicine is about body, mind, spirit. So the body can affect the mind. If we're in pain, we can become grouchy and irritable. And so I like to teach people relaxation practices, mindfulness practices, ways to self-calm and de-stress, and also by working on the pain with the acupuncture, moving stuck energy, and then teaching them how to be more tolerant of the pain while it's resolving, or just better coping skills. Some people will have chronic pain the rest of their lives because of maybe nerve damage or things that have happened where even acupuncture isn't necessarily going to get rid of the pain, but one's ability to cope with the pain can be altered. So working at it from every angle can be helpful. I lost my train there for a second, but so how can mood and emotions affect one's health? I began by saying sometimes the physical can affect the emotional and the mental, but also the other way around. We all have had situations where if we're eating a meal and an upsetting conversation happens, or maybe when we're kids, we're getting yelled at every night at dinner time, people begin to develop digestive problems, stomach pains, the inability to really digest and swallow their food with ease. I see this all the time. People who have had traumatic childhoods and, associated with maybe things that they're eating or dinner time or whatever, and they end up with chronic digestive issues. So again, helping them to resolve some of those unresolved emotional traumas from early childhood can be helpful, but also bringing an awareness to what they can do to get themselves into a calm and relaxed mindset before they sit down to eat can be helpful. But what will happen, say, if someone is one of the major organs in Chinese medicine for digestion is the organ of the spleen. All the organs of the body have emotions attached to them, that if you have a predominance of that emotion, it can begin to send that organ out of balance. So someone who's fearful all the time, for instance, will have a diminishing effect on the kidneys. We know that people who have who live in fear all the time have an overactivity of the adrenal glands, for instance. They're always putting out that adrenaline, and then they end up with adrenal fatigue. You could see in that bit of an example how that relates to the kidney energy, the kidney and the adrenals being part of one system in Chinese medicine. And so teaching someone how not to to recognize that they live in a state of fear, and maybe giving them some tools and some skills, and with acupuncture helping to raise the level of the kidney's ability to deal with that, and therefore bring them to a greater balance when it comes to the that kidney energy. But so say someone's a worrier, that really affects the spleen. Someone who's an overthinker, thinking all the time, worrying all the time, can't sleep at night because thoughts are racing, that really wears down the spleen's energy to transform food. One of the jobs of the spleen is to take the food and do the transformation of turning food into energy of the body, useful energy. And if the spleen's ability to transform our food is not working properly, it begins to create what we call pathogenic factors. We begin to not transform the food to energy, but maybe to mucus. And we end up with someone who's very mucusy and very ends up with sinus problems, lots of cysts in their body, places where mucus forms and becomes stagnant. And it creates a situation of internal dampness in the body. This can lead to arthritis, again, that dampness that finds its way to joints. And so, as the acupuncturist, I have to go and tonify the spleen, raise its ability to get its transformative properties back in balance again, and then therefore being able to digest the food to stop creating that damp condition, the mucus of the body, which will then, if we do have mucus and it settles into the sinuses, for instance, that's going to begin to affect our lungs and the way we breathe. And one thing leads to another, as you know, with health and disease. So let's see. The other big diagnostic tools I use as an acupuncturist is pulse taking and tongue observation. I'm always observing the skin and I palpate the body, find out where the sensitivities are. But when I take the pulse in Chinese medicine, I'm actually feeling for 18 different pulses at one time. So I'm taking the pulse on each side, 3 fingers on one side. I'm feeling not just for the heart rate, which is what, say, a Western doctor might be looking for, but I'm looking for qualities of the pulse. I'm looking to feel what that pulse feels like under my fingers, and I'm feeling it at 3 different depths. So I've got a superficial depth where I'm pressing kind of lightly, see if that pulse is able to reach up to where my fingers are at a superficial level. Then I go to a middle depth where I'm pressing down a little more deeply. That tells me 3 other levels. And then even deeper still, I'm taking it at a deep level, and that tells me more about the internal levels of the energies of the body. So on one side, I'm feeling the pulse in 9 different positions, and then on the other side, 9 more positions, 18 positions. But I'm also looking, as I said, for the qualities of the pulse. So certain pulses are referred to, say, as a slippery pulse. A slippery pulse feels like pearls slipping beneath my fingertips as I feel it. And that'll tell me that there is usually a spleen deficiency in someone's body, that they have a preponderance of dampness or mucus in the body, because that has a certain quality to the pulse. Other people will have what we refer to as a wiry pulse, where the pulse is coming up and I feel it hitting my fingers almost like a taut guitar string. And so that will tell me that someone with a wiry pulse usually has some kind of liver imbalance, for instance, or a blood deficiency. Sometimes the pulse feels weak, sometimes the pulse feels really forceful, and it depends on in which position I'm feeling that. And so there are many, many different qualities of pulse feeling. The slippery pulse and the wiry pulse are just 2. There's choppy. There's a whole range. So pulse taking itself is an art, and there are some masters of Chinese medicine who don't have to do any inquiry when you walk through their door. They're such masters at pulse taking that they can not speak your language, but sit down and take your pulse and know exactly kidney deficiency and heart overactivity, and then they work on raising the energy of the kidneys and diminishing the activity of the heart. And I wish I was skillful in that way of pulse taking, but that's not my style. That's just one piece that I look at. And again, reading the tongue. I have people stick out their tongue, stick it way out, and I look at everything that's going on, what the cracks look like, what the coating looks like, whether there is a coating, whether the coating has accumulated in some areas as opposed to others, whether they have a scalloped edge to their tongue will tell me something, whether it's pale or whether it's got a lot of color. Some people have a bluish tinge to their tongue. Some people have almost no color to their tongue. Whether it's dry, wet, all of these things, and where those things land on the tongue tell me something. And you can watch the tongue change over time as you help people to heal and get a greater balance. Their tongue will reflect those changes. So it's very interesting to watch. And the pulse will change too. Even from the beginning of a treatment to the end of the treatment, a pulse can change, which will tell me, help to guide me about where we're on the right track and where we're maybe not there yet. Sometimes people need for energy to be built before we can even manipulate it. So some people come in with a deficiency of qi in general, and I can try to move and manipulate chi, but we can't quite get there until we begin to build the chi or the energy to a certain place, because you can't manipulate it if you can't access it. Children and children, for instance, their chi is usually so vital that you don't even have to do acupuncture. You can just do acupressure, and you can manipulate that chi because it's so available and so almost on the surface. One of the youngest and first young patients I ever treated was the son of a good friend of mine who came to me, and he had a rash happening in this area of his body, but he was petrified of needles. So I didn't do needles. I used magnets, and I used metals. And sometimes I'll use copper and zinc pellets, because copper has the quality of drawing energy to it, and zinc has the quality of repelling energy from it. So you can put, for instance, a zinc pellet this acupuncture point on the body, and a copper pellet on this part of the body, because what we want to do, if there's a rash, it's an excess condition. We want to draw the energy away from where it's accumulated in an excess way, and this is what I did with this young boy. I put zinc and copper. This point on the body is an important point because it's the controlling point of energy in the head. It also has a very strong moving action to it. So by stimulating the chi here, and by drawing the chi from here to here, there's a direct connection between the pathway of energy. By the end of the treatment, his rash had cleared up, and he said to me, "Susan, how come I felt something moving?" And he traced the meridian, because he was so available to his chi, and he was so without judgment about the process that he was just in the observation stage. And I found that really fascinating, and that happened early in my career, so I never forget that. It was a great lesson for both of us. So let's see what other notes I've made. I'm interested in people's definitions of themselves, what their relationships are like, what their spiritual practices might be, what their how they feel about the work that they do. Again, what kind of work they do, how they're using their bodies. Some people are extreme athletes and wonder why they have knee issues. I'm not going to tell somebody not to be a marathon runner, but I'm going to try to help them know ways that they can at least counterbalance that, or to maybe take it easy, because the body is not meant to be asked to do sometimes the things that we do, and sometimes we can help it and sometimes we can't. Sometimes, again, people may have a job where they can't not grip something all day. I've treated construction workers who are working with jackhammers all day, and they come to me with nerve damage and carpal tunnel issues. So we can sort of stay on top of managing those symptoms, but they can't quit their jobs, and they may have to see me on an ongoing basis just to keep that sort of in check. But if they're going to continue to be in an environment that's going to provoke those nerves to want to shut down or to be overused, they're going to probably continue to have their problem. So I hope I'm not all over the place here and that it's making some sense.
I'm amazed by your energy. You are presenting beautifully, but
Thank you.
It takes a lot of strength and concentration, I think.
Thank you. Well, I cultivate my chi. I do qigong practices. I do breathing exercises. I've been a very devoted meditator for over 40 years. I do a lot of things to keep my own chi healthy, to the best of my ability. We're not all perfect. We're all human. We all have stuff. But I do have a strong constitution, but it doesn't come without some effort. And I could do better in some areas of my life, but that, like I said, we're all human, and we do have our stuff. And I'm passionate about what I do. I love what I do. I love helping people. I've been like that since I was a little girl, and always looked for ways to be a good listener And that is a lot of what I do with Chinese medicine. It is about observing and being available and open to people and really listening. There's a lot that's revealed in the telling of someone's story, and so to give them the space and the attention that they have come to you for is usually a huge relief. I'm also a big toucher, and sometimes I think people come to me just for the hugs that they get before and after. Practically, I always end every acupuncture session with about 10 minutes of massage, whether it's their feet or their hands or their neck and shoulders. Again, I think the human touch is a great healing influence, and people don't get enough of it. We've become a society where we can't touch the children that we teach anymore, other people's kids, or people are afraid to shake hands. We're into fist pumping, and gosh forbid any of us should be afraid of a germ. But, so I think touch is a great healing influence, and I try to make up for some of that lack by always hugging and massaging and all that. So I want to make sure that we leave time for questions. And also I brought a couple of people. One of the things that people are always asking about is whether acupuncture hurts. And, it does involve needles going through the skin. The needles are very fine, very thin, very flexible, the width of a human hair, or thinner depending on the person's hair. And the needles that I use are plastic handled, stainless steel, disposable, one-time use only. Since HIV came on the scene, that all changed. When I first started practicing, we used stainless steel needles that we would sterilize in an autoclave. But once HIV came on the scene, all kinds of sterile procedures did change, so acupuncture needles are different. Every acupuncture needle I use comes with its own little plastic tube. And so what I do is I put it into the tube, I pull back on the needle, and then I tap it in very quickly. So it goes in very quickly. There is sometimes a sensation as it passes through the skin, less than a mosquito bite, I would say. Most people would agree. And oftentimes people don't even know that the needles have gone in. So many of the needles, there's no sensation of pain. And then others you'll feel a very slight, like I said, mosquito bite type of a pinch as it passes through the skin. But once the needle is in, it should have no pain sensation associated with it that is lasting. What I'm trying to do as an acupuncturist is to stimulate the qi in the area. So as one stimulates the qi, there's a certain feeling that comes with that, but it's not necessarily pain. It can feel like a tightening, a gathering, a stirring up of energy. I tend to practice a Japanese style of acupuncture, which is less aggressive, so I'm not going in and trying to solicit the qi. I put the needle in and let the qi find the needle, which is a little bit less aggressive, less painful, and just as effective. So I'm going to put a couple of needles on the tray and pass that around, and you can take a look at that. If anyone wants try a needle, I'll be happy to demonstrate for them.
So Susan, when you do the smoke, which I guess is the heat,
yeah,
is it a different kind of a needle, or?
No, it's the same kind of a needle, but what I do is this is a moxibustion stick, so it's a Chinese herb that I use to heat the needles, and its common name is mugwort. Artemisia vulgaris is its botanical name, and it is an herb in Chinese medicine that they take the leaves of the mugwort plant and they dry them, they cure them for 12 years until they compress them and put it into this form. So what this is I take this, I light the end of it, and I use it to heat the acupuncture needles. So I'll have a needle sticking out of a particular point, and I will hold this near the handle of the needle. It's a very comforting and very soothing amount of heat that we use, and it heats the needle, which sends heat into the acupuncture point, into the acupuncture meridian, and all the surrounding tissue. So it helps to increase circulation, increase energy, and by adding heat is a form of energy. It can help to bring energy to a particular organ. If I'm working on, say, the kidney, yang, qi, acupuncture points, by heating those up, it'll help to strengthen the energy of the kidney chi. So I'll pass that around. And the other thing you can do, you probably all know some of the principles, or maybe you don't, but reflexology is the treatment of different areas of the body by stimulating the different areas of the foot or the hands. In Chinese medicine, we oftentimes use the ear. There's a corresponding body part that can be found in the ear. So sometimes people are missing a limb, for instance. Well, I can't go in and treat the lower leg, but I can find the lower leg point on the ear, treat that point, and it can help, say, resolve phantom limb pain. That's one of the ways that you can use the ear points. But I also use the ear points just to back up the body treatments that I'm doing. There's a lot of points in the ear that are very effective to use for calming the spirit of the body. So during acupuncture, once I get the needles in place, I oftentimes leave people to take a nap. It's a very relaxing experience. It puts people into an alpha state, which is that meditative state, not quite asleep, not quite awake. But there are points that I usually use in the ear to help facilitate that state for people during their treatment. Dr. Barbeau tells an interesting story about when she was a doctor in remote parts of Bolivia, was it?
Mm-hmm.
Was it Bolivia? She had very little medicine for her patients in the villages that she administered to. So she didn't have much to work with, but she did have one book on acupuncture, and she herself endured a series of attacks of pancreatitis and had nothing to treat herself with. But she had an acupuncture book, and she looked up the ear model in the book and found the point where you can sedate the pancreas, and took some old hypodermic needles and put them into her own ear points.
Wow.
And it was all she had to use, but it did the trick, and her pancreatitis resolved, or at least calmed down. So I found that a very useful, interesting story. I'll just pass that around if anybody's interested in that.
Susan, what's the same points you put the needles into the earlobe? Also be receptive just for acupressure?
Yes, any points that we use anywhere on the body can have. You can have a temporary, more of a superficial effect if we do acupressure on those points. And we're going to end the class today with. I'm going to teach you a couple of acupressure points that you can do for yourself that I find really useful. That I tend to teach my patients. I like to send people home with easy homework to do and tricks that they can use on themselves or their children. And so we're going to do that, but maybe we can field a couple of questions before we get to that portion of the hour that's almost up. Anybody?
What happens if you don't have a spleen? You said that changes
Yeah.
food to...
Right.
What if you don't have your spleen?
You still have the energy of the spleen, and there's still, the body's always compensating for what it's lost. So, you'll end up having some issues that you did not previously have when it comes to digestion. You can function without certain organs, but you're not going to function as well as you would if you had them. So people will often have their gallbladders removed, and they really maybe can go back and eat cheese again and those fatty foods, because that's the issue with the gallbladder imbalances oftentimes, is that it's emulsifies fat. So without the gallbladder, you're going to digest those fats quite differently, maybe end up with more problems down the line, but you can still function without some of your organs, but not as well. So yeah, that's interesting. I was listening. Well, that story will take too long, but the energy of the body still exists. I heard somebody yesterday who was a double amputee. She's an athlete. She had her legs removed from the knees down after contracting a case of, I think it was encephalitis. And she was an athlete, and she talked about how even though she didn't have legs and hadn't had them for over a decade, that she still had feelings in her legs, not phantom limb pain, but she had sensations that were still present where her legs used to be. And that she was a very good visualizer, and she had gone from losing her legs to becoming an Olympic athlete.
Amy?
Amy,
Amy.
yeah. I saw her on an Oprah interview, and she was talking about how, with the power of her mind and her imagination, and visualizing herself being able to get out on that snowboard again, that she would become, and it is an amazing story. And she tells a story about she's so aware of her body and her body sensations that she can still feel the energy in those lower legs, even though there's no lower leg there. So the energy still, the meridians are still running, even if the flesh around them is not there. And she talked about how she can walk outside and imagine that she felt a raindrop hit her big toe. And she looks down and a raindrop is where her toe would have been. And so what we think we know about the body and the body's ability to sense itself is a fraction of what it can actually do. So there's a lot to learn, and energy can't be underestimated. Neither can the power of the mind over the body and the power of the body over the mind. So let's talk about some acupressure points I can teach you for yourself. And I'm going to pass these around. Pardon my handwritten notes and mediocre diagram, but they'll do. I think that they'll do the trick.
I don't know if Amy spoke about it, but she was on Dancing with the Stars.
Yes, they had some clips. They had some clips of her, an amazing dancer, and she'd never danced before.
Yeah.
And the command that she had of her feet, her mechanical feet, was just so inspiring. And her whole story about that whole time when she lost her legs was really inspiring. She did an episode of Oprah on Super Soul Sunday. I don't know if you know those, but it's an hour-long interview where she'll talk with people who have very inspirational stories to share, and it was really good. It was very good.
Did you ever listen to TED?
Oh, I love the TED Talks.
Yeah.
I think she
It
might have
sounds
done
like
a TED.
TED.
Yeah, I think she did a TED Talk.
Wouldn't be surprised.
Yeah. I love the TED Talks. So I'm going to teach you, I think, 4 different acupuncture points that you can use for acupressure for yourself. I think I only have 3 listed here, but there's a 4th one that I think will be useful. The first is GV20, governing vessel 20. The governing vessel is a pathway of energy that starts at the tailbone, runs right up the spine, and ends right here. But there's a point at the top of the head that's called GV20. And the action of GV20 is that it has the ability to pull energy up in the body. So it's very useful for things that are trying to fall out of the body that we don't want to fall out of the body. Like when we have diarrhea, when we have hemorrhoids, when we're hemorrhaging, when we have to pee but we can't find our way to a toilet and we want to pull that energy up a little bit. GV20 is a very useful point to use. So I like to teach this point to my patients for themselves and to teach their young children, because when they're at the mall and can't find a ladies' room, it can be very useful to buy yourself a few extra times to make it to when you have the key in the front door and you just got to make it to that restroom. It's a very useful place to help sort of interrupt the flow of something that wants to leave the body and give it some pause so that you can make your way. It's very easy to find this point. Take the heel of the palm of your hand, place it between your 2 eyebrows, and it's where your middle finger naturally falls on the top of your head. So this is what I look like sometimes when I get to my house. Getting that key in the door and pressing GV20. Press it, palpate it, give it a little pressure. When you do acupressure on yourself, it should not be with just a light touch, but with a good press. And you can
hold it steady.
I press it, I massage it, I tap it. Sometimes I'm driving like this. But it can really buy you those few extra moments. So I think that that's a good point to use. It can be sensitive. It can be sensitive.
Okay.
It's also a very important point in the body because this is a chakra, this is the opening of a chakra, and we receive ancestral energy through this way, and it's a very useful point when you're doing Qigong and other visualization techniques where you use to connect your body with the energies above. And so I hope I've explained how to find that well enough through my description, but you'll see my little diagram at the bottom. It's just a reminder of that the point is at the very top of the head. Then we're going to go to PC6, pericardium 6. The pericardium meridian, it runs from the middle finger into the chest. The pericardium is the chamber, the capsulization around the heart, basically. And pericardium 6 is a very useful point. How you find it is find that it's on the palmar surface of the forearm, so the palm surface of the forearm. Take 3 fingers and place it at the wrist crease, and it's where the 3rd finger falls. You might know this point because they sell those Acubands that people will use for motion sickness or on boats. What do you call it? No, what is it called when you're on seasickness? This point, the action of pericardium 6 is broad, has a lot of uses, but basically what it does is it helps to calm and expand the energy in this area of the body. So it's very useful for opening the throat, the swallowing mechanism, the breathing. If you're having trouble breathing, if you're having an anxiety attack, it can help to calm the energy of the chest. It can help to settle nausea and indigestion. It is very useful for if someone's choking. There was an incident where I saved the life of somebody in a Chinese restaurant because it was one of those moments, those proverbial, is there a doctor in the house? And there was someone choking in the other room, and I immediately, without thinking, just got up and reacted. And there was a woman at a banquet who was choking. 3 people had tried the Heimlich maneuver unsuccessfully. The ambulance was on the way. She was turning blue. And I just walked up to her and I grabbed her by the forearms and I pressed on pericardium 6, and this big piece of meat just went flying over my shoulder.
gosh.
And she began to breathe again. And nobody really knew what I did. I just did that, and I saw that she was fine, and I walked away. I didn't explain to who I was or what I'd done. But I found, I just did it by instinct, and I was really so amazed and happy. But again, because we were able to relax the constriction of the throat and the swallowing mechanism, she had just that enough space open up where she could expel that piece of meat. So I'm not saying do pericardium 6 maybe before you do the Heimlich, but it can be useful, and it is a good point to know.
Do EMTs know about this?
I probably not,
Something
but
that
it
they
would be, yeah.
Would be helpful for them. too.
Yes, exactly.
And you did it on both?
Yeah, I grabbed her by both arms. If I'm doing it on myself, I can't do both arms simultaneously. But if I'm having nausea, it's a point that we use to what we refer to as settle down rebellious stomach chi. Rebellious stomach chi looks like stomach chi going in the wrong direction. The chi of the stomach should be receiving food, digesting it, and sending it downward. If it's rebellious, it's sending it upward. So we end up with reflux, we end up with gastrointestinal, energy coming up this way. It can look like hiccups, vomiting, nausea, all that kind of thing. So to settle down rebellious stomach chi, pericardium 6 can be very useful. So again, I'm gonna, take 3 fingers, find where your wrist crease is, and then place your fingers at the wrist crease, and it's underneath where the 3rd finger rests.
Susan, I have a question. I had wrist surgery, and the scar is going right
Oh,
across
yeah.
that point. So
No,
does
your
that
third
interfere
finger.
with
Oh, okay.
that flow of energy here?
The scar tissue always does interfere with the flow of chi to a certain degree. It always finds its way around and
I see.
through, but there may be. I do a lot of scar tissue work on people, and if the scar is an issue. But for you, I would just go still to the point and
Right.
stimulate it there, because the chi is flowing beneath the scar tissue as well. But so when you do acupressure, it's not just a light pressure. I'm giving it a good indentation with that thumb, and I'll hold it for a while, and I'll move it around some and massage it a bit, and then I'll switch over and do the other arm. So I will end up doing both. I just can't do them simultaneously on myself But if I were doing it on somebody else, I would do them simultaneously. And oftentimes you can start by feeling nauseous, and by the time you're finished, the nausea has abated. Or the motion sickness. Again, it's useful for motion sickness. I will oftentimes put a magnet on this point for my pregnant patients who have morning sickness, and they'll wear those magnets for 3 months, 6 months, 9 months at a time, depending on their need, to keep that nausea at bay. Again, it helps to reverse that rebellious stomach chi that women will go through sometimes when they're pregnant.
Then do the second wrist?
Yeah, I start by doing if I were doing it on myself, I
Yeah,
do
on
one,
yourself, yeah.
and then I would go to the other, and I might go back and forth. And if I was doing it on somebody else, I would do both simultaneously. Yeah. And so then the next point that I'm going to teach you is large intestine 4, Li4. Hegu is the Chinese name. And this is the point that I mentioned earlier when I was talking about the zinc and copper pellets. It's where I would have put the zinc, the copper. This point is very useful because it is a very strong moving point in the body. So if you're dealing with any kind of stuck or stagnant chi, it can be very useful for moving that. It also is the controlling point for anything happening in the head. So it's very useful for headaches, for toothaches, for earaches, for draining sinuses. It's very useful for that. So how you find this point is you make a loose fist. You find the place between the index finger and the thumb, and now tighten that fist, and you'll feel that muscle. It's the height of the muscle that's formed when you tighten that fist, and that's where the point is. And so find the point, and now you can relax the fist, and then I take my thumb, and it's usually sensitive because this is one of the strongest muscles on our bodies. This muscle gets used almost more than any other muscle except maybe our eating muscles. But doing acupressure on this point can be very good for draining any excess energy that is stuck in the head.
It says intestines too.
And it's very good for it because it's a large intestine point and it's a very strong moving point. It's a very good point to do for constipation. If you're on the toilet and you can't quite go, if you sit and do some acupressure on large intestine 4, it might very well get things moving.
So one question, when you press that point, do you keep the fist a tight
No, I
fist?
usually relax my fist, open my hand, and do like this. It's just the way to find the point. And you can do it like that, but this is usually how I would do it. And it's sensitive usually on
Yeah,
people.
just hurt myself.
And when I do acupuncture on this point, it usually gets a strong charge, a strong reaction because there's a preponderance of chi there. It's one of those strong moving points, so sometimes it has a strong reaction when we stimulate it.
How long would you hold it down for
I
or
would
massage it?
do a couple of
Couple
minutes,
minutes.
couple of minutes on each side.
I was taking a yoga class one time and had a headache
Yeah.
that just got worse as I was taking the class. And one of the gentlemen that I was friendly with, he came over and he went right to my hand. And it hurt because
Yeah.
he did it so hard.
Yeah.
But it just relieved a lot of the pain.
Yeah.
Yeah.
There's nothing better than experience.
Yeah.
You know, it's like when I had that bladder infection in acupuncture school, it changed my whole perception of now what I was going to be able to do to help people because I had the experience of not having to take those antibiotics, and it helped me to know from an experiential level what so much more that I could do to help people, which was really exciting. And so one of the principles with acupuncture is that, so if say somebody has a headache or a sinus infection or an earache, you want to stimulate. If I were doing acupuncture, I'd put points in the area of discomfort, and then I'd find points further along on that pathway of energy to help draw. So I'd stimulate it in the area to kind of stir it up, and then I'd find points further along in the pathway to help draw it away. So if you have a headache, find the places. Some people get their headaches here, some people are here, some people are here. Do a little bit of massage, stimulate it, try to get the blood flowing, and then do your large intestine 4, and those will work together to help sort of stimulate it, get it moving, and then drain it away, draw it away by the action of this point. It can be very useful. And then the last point that I'll teach you is a point referred to as Sanjiao Triple Warmer 3, which is, I don't have this on our little cheat sheet, but I do like to teach it to people because it's very useful. It's the most important point for helping with the ears. If you have congestion of the ears, if you have vertigo, which oftentimes is an ear issue, if you have a wax buildup or an ear ache, how you find this point is that it is it's behind the knuckle of between the fourth and the fifth finger. So take your finger and run it along up and over the place between the fourth and the fifth knuckle, and your finger automatically falls into a little depression there, and that's Triple Warmer 3. So again, especially around in Vermont, we're going up and down hills, and our eardrums, we ask a lot of our eardrums to, balance out the pressure, and sometimes they can and sometimes they can't. I teach this to people who are going to fly and who have issues with their ears flying. So again, I would find places around my ears, stimulate them, especially right behind the ear lobes, the ear flaps. There's a place right behind there. This is also a triple warmer point. So I would do some massage there, over my ear flaps, wherever I find any sensitive places, pull on my earlobes, get things moving, and then do acupressure to Triple Warmer 3.
And the pressure point is not between those fingers, but a little further
Not
down.
between the fingers. Follow the knuckles. Follow to where it's behind the knuckle,
Oh, I see.
and it falls into a natural indentation there. And a lot of times, if I'm doing acupuncture on somebody who comes in with congested ears, they can actually feel things begin to drain while the needles are in. Or sometimes when you're doing this, you'll begin to feel things open and clear. So it can be very useful.
Is there anything for the back? I was looking on the ear, but I didn't really see anything.
Yeah, there's on the ear. It's this ridge. Let's see what it says here. See the thoracic vertebrae, lumbosacral vertebrae, cervical vertebrae. It's this ridge.
Inside.
Yeah, it's
Inside.
on my ear. It would be this ridge. It would be this ridge right here.
Oh, that ridge. Oh, sciatica. I see sciatica.
Yeah, you see where it says lumbosacral,
Oh, yeah.
cervical vertebrae, thoracic vertebrae. This
Okay.
follows the back right up there. Here you come up to
Yeah.
it starts from the upper back and goes to the lower back.
Okay, thank you.
And for acupressure, there's a good on either side of the index finger knuckle, that first knuckle. There, if you press on either side of that knuckle, that will help sometimes relieve back tension and backache. And also, there's a point on the side of the hand. It's the one that we learned in our tapping class last week, called small intestine 3, and it is the controlling point for energy of the spine. So when people come to me with back problems, I always will needle small intestine 3, and so to do acupressure there, again, you find it by letting your finger run along the side of the hand until it falls just behind the knuckle of the fifth finger, and do acupressure there.
Are there often different sites for the same organ? Like this was for the back, but this
Yeah.
was for the back, or there?
Right, there are different
Separate.
sites for the same organ. There are also different points along the meridians. So, the kidney meridian, for instance, has 27 points. Some will be building of energy for the kidneys, some will be diminishing of energy for the kidneys, some will be to warm the kidneys, some will be to cool the kidneys. So every point has its own action, as well as many points to choose from. Sometimes I can't access point. When I hurt my own back, I can't necessarily access the areas and the back points that I might do, but I can reach small intestine 3, and I can reach some points in my ears, and I can reach points that move stagnation anywhere in the body in general. So there are ways that I can self-treat, even if it's not the optimum treatment that I would do for somebody who might be on my acupuncture table. So people love their acupuncture treatments. They never believe me in their first time in when I tell them that they may fall asleep during treatment, and they think, how am I ever going to fall asleep with needles sticking up in me? But then I come back in, and I've turned the lights down, and I've left them in a nice, quiet, relaxing room, and I come back and love the sound of someone snoring. love someone drooling. So I do treat people with a lot of tenderness and care, and as it should be in a healing environment. So again, I am not healing anybody. I'm just trying to create a condition where the body can heal itself. And I never underestimate what that might be with somebody.